Bob Inglis here. You know, at a time when the federal government's tax receipts are just enough to cover mandatory spending, that's Medicare, Medicaid, Social Security, and interest on the debt, and that means we're left borrowing for everything else. At a time when we're in those straits, the Democrat majority wants to pass a $1 trillion health care bill. Now, that bill is going to be crammed down. They're going to attempt to cram it down this weekend through the procedure of reconciliation. This week, I presented on the House floor letters, over 3,000 letters from the people of the 4th District, saying this to Speaker Pelosi. I write this letter to say emphatically, I do not want this massive health care bill. I believe it costs too much, it taxes too much, and it would kill jobs. Reconciliation is the utmost of partisan maneuvers on such a bill and would be ill-advised. Healthcare reform needs to be addressed. Getting the economy going and restoring jobs should come first. I'm among those who favor a step-by-step, common-sense approach that focuses on lowering costs for families and small business. I presented these letters, over 3,000, to the Speaker and said to her, the consent of the governed is where governments get their legitimacy. And when we don't have the consent of the governed and they cram down legislation, we lose legitimacy in the House. So I've called on the Speaker and the Democratic majority to back up and to reconsider this bill so that we don't have a cram down this weekend and so that we can have reasonable health care addressed in the House in reasonable order in normal procedure, and that we first focus on the economy, because getting people back to work and getting a handle on this spending, that's where we should be starting. And then, as these letters say, over 3,000 of them, we can take a step-by-step approach to fixing the problem of health care. Bob Inglis here. The fight is on about reconciliation and the cram down of health care. Let's hope we win it this weekend. We're in the minority here, but us and the people equal a majority. Thanks for listening.